Hi, my name is Mary Chang, and I'm a professor in the biology department at UTM.
My name is Shanna McCauley, and I'm an associate professor and currently serving as the associate chair of research for the biology department at UTM.
So I've returned to the lab since the university opened on June 15th, and my experience has actually been quite mixed. I've noticed that most of the researchers have been wearing masks while in public areas of the campus, such as the corridors, but there was still a sizable number of people that elected not to wear masks. So that was actually at the beginning when the university just opened. But since then, I feel that things have improved with consistent and frequent messaging. More and more people are actually wearing masks now.
So my lab does a lot of its work off campus. We have had some work going on since the university began reopening, and we've had a pretty good experience. Now, partly we do some work in the lab, but we were able to maintain very few people. The other thing is some of our work has actually happened at the UTM grounds, and people have been quite respectful and have managed to keep their distance. And so while for example, my graduate student ran an experiment out in the courtyard of Davis, she found that people were very respectful. And of course, being outdoors is quite a lot safer. So we've been fairly comfortable. However, we have been trying to minimize our amount of time in the building, in part because we know that capacity is limited. And if we can work out of the building, that sort of frees up some of the capacity within the building. So that's been part of our strategy. So the Koffler Scientific Reserve is open, although it's subject to the same sort of rules. So you have to apply and you have to make sure that your plan is approved. And that all goes through John Stinchcomb, who's the reserve director. One thing with the Koffler Scientific Reserve, of course, again, being outdoors, we're able to conduct research relatively safely, but still we're maintaining social distance. So for instance, people aren't working together. My graduate students are having to do the work on their own. Also, facilities are not open. So the lab is not open. If you need equipment in there, you need to coordinate with Kate Brown, who's the manager. Nonetheless, they've been incredibly helpful. Both John Stinchcomb and Kate Brown have been very helpful with graduate students who are beginning to resume their work, with getting them permissions very quickly, and with getting equipment that they need. So Koffler is open, but you do need to go through all those procedures. And I think if you do that, we have a very safe working environment there.
Is actually for the health and safety of our graduate students, our undergrads, our staff, and our faculty. COVID-19 has really changed how universities work and how we do research and teach. It's actually very important to realize that the research must go on, but it must go on in a safe environment. So for me, I think as a professor of biology, and as a member of this community, I would want to emphasize that mask wearing will save lives. This is a very dangerous virus. People should not let their guard down. People must remain vigilant. So mask wearing will ensure that you don't infect another person. And if we all wear masks, we can protect not only the community, but also our families when we return home from work.
My biggest concern right now is that as things begin to open up, we face the risk. And one of the big issues is fatigue. We are all, right, tired of doing some of the things that we are doing to protect ourselves and to protect our loved ones and protect our colleagues. But masks, right, these are incredibly valuable. They're very simple, but they can help us protect our families. And it's very easy. As it gets warm and we move out of what is typically flu season, you feel like, yeah, it's probably okay. You know, Ontario has been doing a pretty good job. But as we've seen in the States, these things can come back very quickly and very viciously. I'm also concerned that young people, you know, they haven't typically been as badly affected. But one, nobody is safe. And that's the thing that we're really learning about COVID, is that who is hit hard by this does not seem to be related just to the risk factors we know, but sometimes can be really random. And because of that, we want to make sure that young people are taking care of themselves and also taking care of their families. We know that a lot of people can be transmitting when they're asymptomatic. And so one of the big concerns I have is that people will feel like, I'm tired of this. I'm tired of wearing a mask. I'm tired of not seeing my friends. And they'll let their guard down. And as a result, they'll either become very ill or they'll carry it to their families. And there's both the risk to their own health, physical as well as psychological, And so I really think we have to hold the line, and that's critical, and it's hard. And we just have to all realize we're in it together. This will pass. And what we do now is going to have a huge effect on the future that we go to.
So at UTM Biology, there's been a very good effort to educate and push for mandatory mask wearing while on campus. Recently, our department's chair, Professor Joel Levine, and his graduate students, Becky Rook, with the help of others, put together a petition asking the university to mandate mask wearing. I can't emphasize enough how important this is. Recent studies have shown that up to a third of COVID individuals are asymptomatic, and they contribute to over 50% of transmission. So even if you think you don't have COVID-19, you may unintentionally be spreading it to others. So the best way to protect yourself is to wear a mask when in public places. Now, that's not the only way. We need to adopt and embrace core behaviors that limit the spread of COVID-19. So in addition to mask wearing, we should be observing physical or social distancing. We should not be congregating in large crowds. We should practice good personal hygiene, like frequent hand washing. And if you think that you've put yourself at risk, you should get tested. And if you're positive, you should self-isolate at home. This is really the only way for us to defeat this virus.
So I'm really in support of this petition. And I think one of the things that we've learned is, the science has changed. Initially, it was unclear whether masks mattered, but more and more evidence is coming out that a lot of transmission occurs through aerial transmission of droplets. And this doesn't even necessarily mean a big sneeze. This means that as we speak, we expel droplets. This, very simple, right, can be even kind of cute, right? Technique can save lives. You may feel fine. Again, a lot of people, we don't know the exact percentages, but up to 30% are asymptomatic. Also, people may become symptomatic, but still be transmitting before they actually develop symptoms. So wearing a mask is really a way to very politely protect other people. And you're asking them to do the same. We've all adopted a number of things. We all wear shoes, right? You go into a store, you wear your shoes, and we don't question that, right? It's polite. You don't want your dirty feet on the floor. In this case, we're just trying to protect any of those small droplets, any of the things that we might be transmitting from reaching others. And this, in combination with physical distancing, with good hygiene, washing your hands, are critical for protecting other people. And I think that's one of the things that really has to be emphasized. People sometimes say, I'm not afraid. I don't think I'm at risk. It's not about you, right? The truth is you need other people to be wearing their masks to protect you. You're wearing a mask to protect other people. And so it's a relatively simple thing. You don't need to do it when you're on your own. You don't need to walk around your house with that. You have lots of the day where you don't need to wear a mask. But when you're in public and when you're on campus, please wear a mask.
So my message to the graduate students is, even though COVID-19 has really changed how we live our lives, you shouldn't live it in fear. You shouldn't be afraid to come to work and progress with your graduate research and graduate education. I want you to know that at UTM Biology, the staff and the faculty have your back. We will advocate for safe working conditions for you as you come back to work. At the same time, I ask that you make some responsible choices in your life, such as physical distancing, not going out to bars and having a good time, remaining vigilant because we are still in a very serious pandemic. We only need to look at south of the border to see how bad it can be. So I ask you to make responsible choices, but not to live in fear. And I hope to see many of you back to work come September.
To our graduate students, you are a critical part of our community, and everything we're doing right now is to try to protect you, protect your families, protect your friends. And I think that in a way this, these are hard times, but on some level, it's showing us the best of ourselves, right? We see people coming together. We see people making tremendous efforts to stay connected with one another, to keep their work going even in difficult conditions, and to do things to protect each other and to help each other. And I'd just ask you to keep doing that. Reach out to people. If you feel like you haven't seen a lab member or heard from a lab member in a while, people are struggling. It's hard to be this isolated. It's hard sometimes to be very concerned about where is your work going, what's going to happen. So reach out to lab members. Zoom is a great tool, or give them a call. Make responsible choices. Do the things you need to do to protect yourself, to protect your lab, and to protect your family. But make sure you do it in a way that is healthy for you, right? By reaching out to people, by recognizing that, this is a community and it's a community that cares about you. And we'll get through this and we'll all be back together. And the best way to do that is to make those good choices and to take care of yourselves and to take care of others. So thank you for all the work you're doing in this community.